so we're here to talk about the ethics of antimicrobial stewardship. So we'll start by talking about antimicrobial stewardship as a response to antimicrobial resistance, and talk about how it's been conceived as a technical problem, and the need for it to be understood as an ethical problem, and then highlight some of the questions we'll need to ask in order to address stewardship as both a technical and ethical problem. So we're all very clear what's going on today, why AMR is a threat from which no one can escape. We're now very clear about all of the health, economic, and social consequences, both for ourselves within the UK and developing nations, but globally in terms of developing nations, and also for people who just do not yet exist in terms of the threat to future generations. And it's this shared, interdependent vulnerability to this threat that creates an imperative to respond. And I'm interested in a particular response that's taken the form of antimicrobial stewardship. Antimicrobial stewardship focuses on preserving antimicrobial effectiveness. And traditionally, it's focused on the clinical setting. In particular, it's sought to promote optimal antimicrobial prescription, as well as trying to reduce antimicrobial misuse or overuse. We're starting now to see an expansion beyond that clinical setting in order to focus on improving infection surveillance, prevention and control, stronger pushes to develop new antimicrobials, as well as reducing non-essential use of antimicrobials in the agricultural, horticultural, and farming industries. So again, we're not looking just to the actual drug itself, but the behaviors and conditions under which that drug will be effective. The problem is that current stewardship activities predominantly focus on this as being a technical problem to be solved, and are only asking these how questions. Again, how do we improve prevention? How do we optimize prescribing? How do we increase surveillance? So while these technical problems and questions are of course essential to our AMS activities, it's misguided to think that they should exhaust our stewardship approach. A steward has to ask both the why and whether questions that underpin these technical matters. So we have to be clear that antimicrobial stewardship involves decision-making and policy-making that's inherently and inescapably ethical. So again, we all agree, of course we should improve infection control practices, but how far should we be allowed to go in restricting the choices and actions of individuals? Again, everybody in the room would agree, of course we should reduce misuse and overuse of antimicrobials, but just how much risk is it going to be ethically permissible to subject patients to in order to achieve this? We all agree, of course, we need to encourage changes in prescribing behavior, utilization, hand-washing practices, of course. But what kind of behavior-changing interventions would it be permissible to subject the population to in order to achieve this? Should we only be allowed to promote awareness and have education campaigns? Or should we be allowed to nudge, incentivize, try to coerce, maybe even manipulate people, given how high the stakes are? Again, people aren't addressing these kinds of questions. Acting as an antimicrobial steward, then, will involve making particular kinds of moral judgments, promoting particular values, and prioritizing different kinds of aims. And these are normative, not technical activities. So in addition to stewardship having these kinds of ethical implications, we also need to recognize that stewardship itself is an ethical value. It's an ethical project. And inherent in this kind of project are notions about ethical behavior and good decision-making. So these kinds of ideas need to be addressed within our stewardship activities. My suggestion is that a failure to adequately address these ethical issues can have a direct impact on the success of our AMS activities, and it's a massive failing for us currently that our approach neglects to help stewards identify, reflect on, and resolve the numerous ethical and related legal issues related to being good antimicrobial stewards. And unless we have a proper understanding of what it means to be a good antimicrobial steward in a robust sense, we're not going to be able to handle the numerous and complex ethical and legal issues involved in being antimicrobial stewards. So we need to move away from this idea of mere technical stewardship to that of good stewardship, in which we're also including what it means for our strategies, our policies, and our activities to be ethically justifiable, to be fairly developed, and to be soundly implemented. And to do so, that means we're going to have to start to ask and answer some fundamental conceptual and normative questions that go beyond the technical. So first, just start about just who are going to be the individuals and institutions that hold the role of antimicrobial stewards. And on what basis can we demand that these people and institutions hold these roles? And is it going to be possible for people who aren't stewards to still hold some kind of stewardship obligations? People talk about the possibility of guardians or champions. But again, on what basis do people hold those obligations? And when we actually identify these relevant people, on what basis and what can we do to hold them responsible when they fail to uphold their different stewardship obligations? We also need to look at the values that the steward should use. So even if we get a lot of wide agreement on different protocol and policy papers about antimicrobial stewardship, they start to use normative terms such as being responsible, judicious, appropriate, accountable. These are normative terms, again, that require moral and value judgments. So for instance, if we talk about the best use of antimicrobials, it's going to matter whether best is understood in terms of harm reduction or whether the best use is understood in terms of providing equitable access. Right? So we have to examine the values that stewards are going to use. We also need to be clear that the benefits to be obtained from preserving antimicrobial effectiveness will require us to impose burdens on each other that potentially increase our risk and limit our choices. This is going to require moral justification. We also need to know that good stewardship is not just going to be about curbing excessive use. We must also be concerned with guaranteeing sustainable fair access to those who don't yet have access, for instance, in low and middle income countries. Again, this requires moral justification. It should be the case that a good steward provides equal access to everyone, or is it possible to give priority to certain people? Should we give priority to individuals versus groups? Should we give priority to future generations who don't yet exist over current generations? And should past behavior and contribution to current levels and rates of resistance be taken into account when we decide who gets access to these valuable resources? So, another question we need to ask, we kind of assume that what goes on here in the UK should go on in other parts of the world, but is that necessarily the case? We seem to presuppose that we always want to maximize patient outcomes, minimize expenditures, and flow resistance at all costs, but should that always be the case? Is it going to always be the case that a good steward has to fulfill their stewardship obligations in the same way? Is it possible that these obligations might be understood as being context sensitive? That given different patient populations, conditions, and resource availability, we may expect good stewards to act in different ways. So lastly, this AMR is an uninterrupted vicious cycle that's going to continue no matter what we do in developing these preventative, diagnostic, and treatment agents, which makes addressing these ethical issues even more important. We need to understand stewardship as a fundamental ethical project and the ability to use stewardship as a tool being informed by these ethical and legal considerations.